So hey guys, so I'm so sorry I'm a little bit late today. The the computer wasn't working, so I had to get a different computer. This one looks so clear. You guys can see me good. Okay, so today we're gonna go over peds and maternity, and I'm gonna give you a number so you guys can call in actually. So let me just get that number for you, and I'm gonna just pin it so you guys can call in if you have any question. We're gonna just go over peds and maternity today. So let me put the number in this chat right here. Nine five four 41. So you guys can call that number, and you guys can come on and we can talk about peds. Yes. Oops. Waiting for a couple more people to come on. Let me see. If I could just get started, I'm gonna just go over my piece notes right here that I have. You guys can see it. So we can go over the theories first. So with Piaget, you have um the way how I remember it by Sam Parent's scary formal operation. And then you have from birth to 2 years of age, you have sensory motor. So you have that, and that's when they start developing like object permanence, and they learn like a basic skill, learn how to trust, the sucking, listening, looking. It's just sensory, and the toys that you want to give to those kids between that age group is a musical box, stuff like that, because they're developing their senses. And then the second one is the pre-operational, and that is between 2 and 7. With that age, the children begin to think symbolically. They use words and picture to represent objects. So, for instance, if they if you have a child, so the child will start using their play toy, or for instance a brush as a telephone, and they pretend that it's a telephone, and then they just start doing a lot of pretend plays. And then right here, 7 to 11, you have concrete thinkers. You can think about 7-Eleven and the concrete. You know how 7-Eleven is. It's normally surrounded with concrete. So you can think of that. And these children, they can think, they think concretely. They don't start thinking abstractly until 12 and up. And they can add and subtract, and they are very rule orientated. So they follow rule to the T. If you tell a child from 7 to 11 that this is how something is done, that's how it's going to be done for the rest of that age group. And then you have 12 to 12 and up, which you have formal operation, and that they have abstract thinking. This is they can reason like adults, and then the brain is fully developed with that. Hold on. Yes. Let me see if I could share this live so some more people can come on and we can start interacting. It's not showing. Hi, welcome. Make sure you give this video a like. I am going over the theories, and I do have a number in the comment section so you can call it and we can chat a little. Hold on. Let me show you my other notes right here. So right here you have atrial septal defect. Hmm. I'm trying to share this live. Let me see. Where is everybody tonight? Where is everyone? I don't see anyone coming on. Um. Oh, so let me talk about cleft lip and palate for you guys, because a lot of people have confusion with that. So with the cleft lip, it's actually a deviation in the lip of the infant, and then with the palate, you have like an opening. With the You have an opening in the palate. So I'll just show you a picture. Cleft lip and palate. So this is how it looks with the cleft lip and palate. So this is how the cleft lip, and then this is the palate. You see that it have a little opening right there. And then for those infants, you want to monitor feeding, their weight, hydration, and their respiratory status. And then one of the things that is like super important for them is positioning the child upright while you're feeding them. And remember, with cleft palate, you position the infant prone, and with cleft lip, they are supine. Yes. I just wanted to do like Q&As tonight. So I'm just waiting for people to come in so we can like can I call who is this? Okay. So yes, I'm just waiting for people to come in because I want to do Q&As. Q&As. Hi. We're doing so I want to do a Q&A tonight. Yeah, I want to go over peds and maternity. So you can call in. The number is right there in the comment section. So go ahead and call in. I'm going to answer and we can talk about that. What do you guys want to talk about? What do you guys want to talk about? I don't know what to talk about. Or maybe I should just show you guys my notes. I'll show you. You can see it like this. Okay, guys, I see you guys coming on. So make sure you guys, I want you guys to call in so we can just have a conversation. So guys, the number is right in the comment section so you guys can call in. And I have a special guest on tonight also. And she has been a pediatric nurse for over several years now. So she's an expert in pediatric. And I think I'm going to call her shortly. So she can tell you guys even more about pediatrics because she's the expert when it comes to peds. So this is how I remember the immunization. So I'll show you guys right here how to remember the immunization. It's really easy. So first you're going to have, let me see, 1, 2, 3, 4, 5, 6, 7. So you're gonna have eight letter slots right here. So 1, 2, 3, 4. I'm gonna do the 7, okay? And then this one right here is going to be birth, so 0 months. And then you have 2 months. Then you have 4 months. Then you have 6 months. Then you have 1 year. Then you have 4 to 6, right? So at 1 month of age, the child will get hepatitis B. So Hep B. And then at 2 months, the child will get hepatitis B. Then the rotavirus. Then they'll get hip vaccine, IPV, and then the pneumonia vaccine, so the PCV. So I remember it as 2B right here. Doctor. Hold on, I didn't put the D. So it's supposed to be 2 within the age. B, doctor. The D tap. The R for rotavirus. And then HIP. HIP, to be Dr. HIP. So that's what they get in 2 months. And then in 4 months, they're going to get four Dr. HIP. So you have in the first, when they are born, you give them hepatitis B in 2 months. So you remember 2B, hepatitis B, Dr. HIP. And then the D is DTaP. The R is rotavirus. The H is HIP. The I is IPV. and then the P is PCV. And then the 4, they're not going to get hepatitis B at 4 months. They're only going to get Dr. Hip. So the DTaP rotavirus, um, hold on, yeah, DTaP rotavirus, Hip vaccine, HPV, and PCV. And then at 6 months, they're going to get it. All right, 6. Then it's going to be HPV right there. Doctor Hip in. So you're gonna do right here like that. So doctor. So B, Doctor Hip in, which is influenza, 6 months. So after at 6 months, that's when the child's supposed to start getting their immunization for influenza vaccine after 6 months, and then every year after that 6 months. So 6 months is B, Dr. Hip in 6 months. And then in 1 year, you're going to have a MAD. So a MAD HPV. So the one, yeah, so that is at 1 year. That's going to be the first time they get their MMR. Then that's going to be the first time they get this the H the Hep A vaccine instead of B, and then the DTaP for the D, then the Hib, then HCV, and then the varicella for the V. So that's going to be MAD HPV right there. And then in 4 to 6 months, that's when you're gonna just write a very dim, DIM. So very dim at 4 to 6. So at 4 to 6 in the evening, it's normally very dim. So the very, it stands for a varicella, which is chickenpox, and then with the D, it's a DTaP. Then the I, it's for IPV, and then the M is MMRs. So that's what they're going to be getting at 4 to 6 months. And then now for the 11 to 12 months, you're going to have human men. So that's what you're going to have for 11 to 12 years. I'm sorry, 11 to 12 year human men. So they're going to get, instead of a DTaP, it's going to be T instead of that. And then the human stands for HPV. So that's what they're getting right there. And then the men, it stands for the meningitis vaccine. That's what they get when they go in school. Thank you for doing this. Oh, you're welcome. You're welcome. So that's what they get when they are going in school. So like if you get a question that asks you when do they give the the meningitis cocculus vaccine, you give it at 12, at 11 to 12. That's when they start going to high school, or you give it to college populations or persons that are normally in like crowded place. Yes. And then at 16 to 18 years old, you're going to give them booster. So boosted. So that's what you give them. So boosted at 16 right here. So who can tell me when do you give the first who can tell me when do you give the first dose of hepatitis B vaccine? Who can tell me what do you get when do you give the first dose of hepatitis B vaccine? Okay. Well, no one's answering, but you give the first dose of hepatitis. Okay, yeah. Yeah, it's crafty. Yes, that's when you give the first dose of hepatitis B. When do you give the first dose of hepatitis A vaccine? Yes. Mm-hmm. And the first dose of MMRs, measles, mumps, and rubella. Yes, at 1 year. At 1 year. Good job. Good job. Good job. When do you give the first dose of HPV? Give you guys a couple seconds to answer. The first dose of HPV. When is it given? Yes. Okay. You're just on it. Good job. Good job. Good job. Okay. All right. And then, the booster is given between 6 to 18. If you guys want to call, the number is in the pin right there. So you guys can call and we can just go over information while on the call like live. Okay. All right. And then one of the important things you guys need to know, like it's like major, like the fontanelles. So who can tell me which fontanelle closed first? Okay, so the fontanelle that closed first is the posterior fontanelle and then the anterior. So what I do is I just remember the state Pennsylvania, and Pennsylvania is PA. So that's what I do. That's what I remember, Pennsylvania, and then I remember the PA. So the posterior closed first, and then the anterior closed last. And then the posterior is 1 month to 2 months. That's when it's closed. And then the anterior is 9 to 18 months. Yes, it's different here in the UK. How different, David? Yeah. Okay, I'm going to call right now. So I'm gonna have someone come on, and she's going to help you. She's a founder of the Utopian family. So you guys can go ahead and subscribe to her YouTube channel. She is a nurse. She is a pediatric nurse. So she knows so much about pediatric and also maternity, and she's gonna be of so much help to you guys. Let me call her right now. And her phone. Hold on. I'm trying to call her for you. Okay. I saw open. Hey, I just wanted to stop by and say that I took my NCLEX today and you really helped. I had a lot of questions about PPE. My test shut off at 75 questions, so I hope I pass. You pass. Listen, you know how to put your PPE on, right? Okay. Okay. Yes, I'm here. You have to turn your computer down because it's echoing.
Oh yeah.
Okay, so this is. I just
wanted to stop by and say that I took my intake today. And you really. It's echoing. Hold on. Yeah.
Okay.
How can I help you, my dear?
So you're going. I missed the name of the YouTube channel. It's called Utopian Family. So I'm going to put a pin so you guys can see it. Um, But she's on the phone right now, and she's gonna go over peds and maternity with you guys. She's been a registered nurse for a couple years now, a long time, and she specializes in pediatrics and maternity. So she'll be a good help to you. And she's the one that actually taught me how to do the process of elimination. So I think she'll explain it better to you guys. So welcome.
Okay. Thanks for having me.
Okay.
So
Yeah.
for Miss Georgia K, I think I'll go over the I was watching your live YouTube, and you was doing pretty good with explaining with the peds, but because you haven't touched maternity as yet, I'll go over a little of maternity for you.
Okay.
And then you can continue with your pediatrics.
Okay.
So as you mentioned, the technique that I show you, how to eliminate questions on the NCLEX.
Yes.
Well, when I'm going over it, maybe you can write it on your board.
Yes, I'll do
so
that.
they can see.
Mm-hmm.
So the first thing that you do when answering the NCLEX question, this is an easy way, because reason for this is you actually get enough time to take the NCLEX. But because you're just sitting there on the computer, one location, and just looking, after a while, and then you're very nervous. After a while, your eyesight start getting tired, and then your brain started thinking about other things, although you're just looking at the NCLEX. You'll be faced out. You're looking at the questions, but not really understanding what's going on. So this is an easy way how to eliminate your answers to get the correct one. So first, what you do, you read the question.
Mm-hmm.
So you read the question once. So Kim, I'm going to talk to you as if I'm explaining it to you. So
Okay.
And I guess your watchers can understand also.
Yeah.
So read the question. You read the question once, right? and then just to understand what they're saying. So first you read once. All right, when you read it once, there's always also look out for a key. Look out for a keyword that is asking you. Okay? So find out what the theme of the question is. So you read it once, find the key and the theme of the question, look at your answers, just read through your answer, don't answer the question as yet, and see if anything pops out at you. Then go back to the question and read again. Because sometimes you miss something, because you have enough time to take the NCLEX. They give you more than enough time to take the NCLEX. So you read the topic. Okay, I'm going to give an example. Say the question asking about abdomen. Okay, GI. Okay, so that you know it's asking about GI. Then you look at the extreme bottom of the sentence, because sometimes they'll ask you what is not, and you will be given the correct answer. So you look at the extreme bottom, what are they asking me? So you have now what they're asking you, and you have what they're talking about, which is the GI. So you look back in your answers. The answers has to do with GI. But it can't be about heart. It can't be about neuro. It can't be about skin or anything else. It has to be with GI. So you go with the elimination now. Always remove 2 wrong answers. Don't choose the right answer as yet. So you remove 2 answers. So you're going to look. These 2 cannot be the answer. For example, as I said, I give you GI. So you're going to remove the one with the heart and the one with the skin. Most time, the 2 answer that is left, sometimes it has to be with the GI. It depends on what it asks you at the end of the sentence. That's how you choose your answer. Then you know with the ABC, as we know, A, B, C. As you're studying for nursing, so you know what the ABC is. If both answer has anything to do with the A, which is airways, that normally be the answer, the airway. Airway comes first. Okay? So it's the process of elimination. You read, then you do the elimination. Did I explain it clear to you, Kim?
Yeah, you did.
All right. Anybody have any question on that I just explained? Or anybody wasn't understanding what I just said? I guess not. So I guess we'll move along and stuff. So as I said, I'm going to go over maternity because you was doing the peds.
Okay.
And stuff. All right.
All right.
So in maternity, as we know, it deals with the mother and the baby. But before comes the baby, it's all about the mother. Okay? So we're going to talk about prenatal care. All right? So, okay, let me break it down into, hold on. So in maternity, they have different stages in maternity. All right, so I'll just go over the stages that the NCLEX normally covers in maternity. So they normally covers in maternity. The NCLEX question normally falls under like prenatal, then postpartum, the pregnancy, and newborn nursing care. Okay, and as I said again, we are all in nursing school, so we have an understanding what is prenatal, pregnancy, postpartum, and newborn care in nursing. So with the prenatal nursing care, the NCLEX normally asks you a question in infertility. So, you have to go over your notes on the infertility and prenatal pregnancy health, family planning. They talk about, also ask about family planning and labs value. They'll also ask you about menstrual cycles and stuff. Maybe on another time we'll go into in depth with the prenatal nursing care, but I'll just touch like topics that you find on the NCLEX that they'll ask you questions on. Then they'll talk about the pre-pregnancy nursing care. All right, and this is a period from the first date of the last period, menstrual period, until the placenta is delivered. Okay, so this involves the antepartum, which is the first trimester, second trimester, and third trimester. And this also include normal fetal development. They'll also ask you about diagnosis of pregnancy and complication that can happen in pregnancy, and that's a big one. The normal maternity labs value, as I mentioned. They will also talk about, but they will also ask you about labor and delivery in intrapartum care, including all aspects of that area. They can touch any basic area. They'll ask you, try to know your fetal heartbeat, your variables, and you should know all those variables. As I said, another time maybe we can go in depth with those.
Let me just talk about those. So
okay, so talk about the variables and then I'll continue from there.
So with the fetal heartbeat, you can use this phrase. It's called veal chop. So veal over here, and then you put chop. Oops.
Okay, whenever you want me to talk, you can tell me.
Okay. So you have a veal chop, and then the V with the C, it stands for variable deceleration, which is card compression. And this one, the intervention for that, you have to push. Then you position. That is the intervention for that one. And then the position that you normally do for the variable deceleration, you either put them in the knee to chest position or the Trilengenberg position, if I'm pronouncing that right. But you guys know what I'm saying. That's the position you put them in, and you want to use your glove and it doesn't have to be sterile because it's an emergency. So you're going to use a clean glove and you're gonna push the baby's push the baby up or the card off the baby so the baby can start to get oxygen, because when they have a variable deceleration and the card is compressed, the baby is not getting enough oxygen. So you want to push before you position, and that's the intervention for that one. And when it comes to the E, this is early acceleration, and then this one is head compression. So with this is when the mom is in labor, the baby is coming. So this one is okay. This the variable deceleration, that one is a very bad. So very bad. This one is okay. And then you have A, which is okay. And then you have the L, which is late deceleration or placenta insufficiency. And when you have that, the intervention for that one is lion pit. So if you have pitocin running, you want to stop the pitocin first. You want to put the mom in a left side position. Then you want to start the IV. Then you, so let me put it, lion. So left side, so left side IV, oxygen, and notify the doctor. That's what you do for late deceleration. And if pitocin is running, that's going to be your first intervention to stop it, because that's what's causing the problem. Okay, you can.
Okay. Whenever you're finished, you can let me know.
I'm finished.
Okay, so she explained the deceleration, the variables and stuff like that. So I'm just going over stuff that they'll touch on in the NCLEX and stuff. So also they'll ask not too much question, but some people will get questions on vaginal delivery and cesarean delivery.
Okay.
All right. One of the big thing in the NCLEX that they focus on also is complication associated with labor and delivery, and some of those complications are placenta abruption and breach, position, and fetal distress. So know the intervention for those, and they're big on the medication with labor and delivery.
Okay, so let me just go over that. All right.
And then you go over it.
Okay.
Because we don't want to lose my sense of thoughts, because we never really prepare. It just are things that I remember all up in my head. I'm just going over it. So with the medication, they're big on Vogam. Alright? For the RH negative mothers, know when a mother is RH negative. The number one medication for labor and delivery is pitocin. That's normally a test question, right? Because you have to know about pitocin and magnesium sulfate. So magnesium sulfate is used very, very, very often in labor and delivery And the reason why they normally use magnesium sulfate is normally for preterm labor when the mother have high blood pressure. And every time you use that medication, the magnesium sulfate, you have to monitor the mother before the mother goes to maternity. Okay, so the medications of choice is Rogam. The medication of choice for the mother is Pitocin. And Rogam if the mother is Rh negative. And magnesium sulfate for preterm labor and high blood pressure. And they also use general epidural for those who have complication, and then they do the epidural management. So if you want to go over anything that I left out, Kim?
Yes, I was.
Or you was gonna... Okay, go ahead.
So I was gonna go over the ways to remember the medication, the labor and delivery medication. So um, so to stop the labor, you want to give them Pitocin or magnesium sulfate. And with magnesium sulfate, you want to always check deep tendon reflexes with the magnesium sulfate. And then to no, that's to start the labor. Wait, sorry, I'm confusing you guys. I think they no.
For Pitocin, they normally start it. They
Yeah.
what Pitocin?
Yeah.
Pitocin does, it contracts the uterus. That's what it does. It contracts the uterus. All right.
Yeah.
Most time when the mother they get the Pitocin, sometimes they'll complain about birth. Most times, like when they transfer to maternity, they'll complain that, oh, I'm feeling pain. It's because of the uterus contracting due to the Pitocin. Okay, it prevents excessive bleeding.
Yes. So that is one of the major things to remember too. With Pitocin, you wanna it is given for hemorrhage.
Right. It prevents excessive bleeding. All right.
Yeah. And then
all right. Go ahead.
okay, so the other medication that I was thinking of about is the medication to stop labor, and the way how I remember them is it's not my time. So you can see right here, these are the medication that you use to stop labor. So indomethacin, and then you have amphetamine, then magnesium sulfate, then terbutaline. So those are the medication you use to stop labor.
All right. You want to go over the Rogam with them with the Rh negative moms?
Oh, okay. So with the Rogam, with the mom is Rh negative and the baby is going to be Rh positive. And with that, you are going to give the mom the Rogam at 28 weeks and then also at 72 hours after delivery. And also Rogam is a blood product, so you cannot delegate it to LPNs. Only RNs can give Rogam.
Okay, so that's important to know because they ask you that in the text.
Yes.
And stuff. So it has to be an RN that does it, and you have to monitor the blood because it monitor the product. Okay. So I go over the pre-pregnancy nursing care for you guys, which is and I cover antepartum which covers the trimesters, first, second, and up trimesters. All right. So after the mother goes to labor and delivery, and then they give birth, then comes the postpartum nursing care. Okay, so with the postpartum nursing care, let's talk about the baby first. So the postpartum goes after birth, and then they'll be in L&D, and then when the patient is stable enough, they'll transfer them to maternity. Okay, if the mother is on magnesium sulfate after delivery because she has high blood pressure, that patient cannot be transferred to maternity. That patient has to be in L&D because they have to monitor that patient consistently. The mother goes to maternity when she's stable enough. Okay? All right. So when the baby is born, the baby will get 2 shots. The baby will get erythromycin that goes in the eye to prevent any form of bacteria or infection. And then they'll get vitamin K. And that normally helps with blood clotting. Okay? With the and then they'll get hepatitis B, but they can get the hepatitis B later. They'll get that they normally get it at birth, but it can be given at a later time in a sense where maybe after an hour or so they can get it. But in order to give the hepatitis B, you have to get a signature from the mom. Okay? If you don't get an okay from the mom to give that medication, it cannot be given. All right? So they'll ask you that on the NCLEX too. They teach us in school when it's supposed to be given. But in the NCLEX, they all know that we know when it's supposed to be given because we went through nursing school and stuff like that. So they'll more likely ask you about giving it and about the signature. But you need a signature to give it. The mother has to say yes, she wants her child to get it. Because if the child doesn't get it in the hospital, they can get it outside in the clinic. All right, and it depends on the cultural aspect of the mom. Some mothers, because of culture or religion, they don't want to give it to their children and stuff. So bear that in mind. All right. So I was talking about the baby. So we'll go back to the mom in the postpartum nursing care. All right. So at this time in the postpartum nursing care, I'm going back to L&D now. So the placenta is delivered. Okay. And that goes in phases. It delivers in phases. So you can just go over your notes and see. Most of you already know because you are most likely at the end of your program. So I'm not going to go in depth in those. And the initial phase, which lasts nearly like 6 to 12 weeks. And stuff, and then the subacute phase will also last 2 to 6 weeks. All right, if you're understanding what I'm saying. So the placenta is delivered, right?
So can I go over the phases?
All right, go over the phases.
Okay. Okay, so you have 4 stages. So you have 4 stages of labor and delivery. So first you have the latent phase, and that phase have three. The latent stage, you have latent stage, and then within the latent stage you have 3 phases, which consists of latent, active, and transition. So with the latent, you have cervical dilation from 1 to 4 centimeter, and then you have contraction every 15 to 30 minutes, lasting up to 30 seconds, so 15 to 30 seconds. Then you have the active phase, which you have cervical dilation from 5 to 7 centimeter. You have contraction every 3 to 5 minutes, lasting up to 1 minute. So from 30 to 60 seconds. And then they have like moderate pain. That's what they describe it to be. And then you have the transition phase where they have cervical dilation from 8 to 10 centimeters. And then you have contraction 2 to 3 minutes, lasting 2 to 3 minutes, and up to 45 to 90 seconds. And then they describe this as severe. That's when the mom is ready to deliver the baby. So in the second stage, this is when the mom is ready to push and the baby is born. That's when you have full dilation of the cervix, so it's 10 centimeter. Then you have the third stage, which is the placenta is delivered. And when the placenta is delivered, you want to make sure that you check it to make sure it is intact, and you want to remember Ava. So you have two arteries and one vein. And then for the fourth stage, it's the recovery stage, and it lasts right after the placenta is delivered, and it's like 2 to 4 hours. Yeah. Okay.
So you're finished?
Yeah, I'm finished.
All right, so I was going over the postpartum nursing care. All right, things that you see on the NCLEX, or what the NCLEX is looking for and stuff, if you get that topic, because it depends on the topic that you get. Because, for example, some people, NCLEX will have a lot of cardiac, some will cover a lot of maternity, it depends. But you will get most of one thing, so it's best for you to know everything. All right. So they're also big on breastfeeding. Also, the changes in breastfeeding with the breast, and also medication that not supposed to be taken by the mother while breastfeeding. And one of the things that they look for also with postpartum is hemorrhage. Okay, that's a biggie.
Yeah. Okay. Let me go over that real quick.
Okay.
So with the hemorrhage, if the pregnant lady or the mother, she had a C-section, it's going to be what considering to consider it hemorrhage, it have to be 1,000 mLs of blood to be considered hemorrhage, and if it's a vaginal birth, it's 500 mLs. Okay.
All right, so that's very important to know. All right, and they're also in maternity. They're also big on normal lab values, and most common labs that they drawn in maternity is they'll check your white blood cell. But normally after birth, the white blood cell is elevated just a little. You'll know the normal level of the white blood cell.
Yeah, it's 500 to 1,100. 5,000 to 11,000.
All right. So if it's a little over with a maternity patient, they're not worried, because after birth, a lot of things elevated. All right. It has to be like the norm for them to look into infection. It has to be real high. And if the mother has infection, they'll pick that up in L&D, because they take blood tests from the mom and stuff. So we go back to the postpartum. So they'll take platelets. That's very big. Platelets. That if you get any lab values in on maternity in the NCLEX, I assure you they'll ask about platelets. Okay? Because the mom lose so much blood. They want to know if it was hemorrhage or not. Alright? So the platelet will let you know. Alright, and hemoglobin and pronounce that word, Kamisha.
Hematocrit.
Right, right. Those words, those. So hematocrit, hemoglobin, white blood cell, and platelets for the labs in postpartum mothers. Okay. So then maybe I can talk about like the baby newborn nursing care. So they are important, as we all know. Also, the Apgar Score.
Okay.
Everybody, I guess they know about the Apgar Score. If you want to go over that with them, with
Yeah,
the parents,
I could go over it. Let me see.
Yeah, okay, go over it for them with the appearance, pulse, grimace, activity, and restoration. All right, so she'll go over that with you. Just touch a little of that.
So with the Apgar score, it's score between 1 minute of life and 5 minutes of 1 minute of life and 5 minutes of life. So it's score from 1 to 10. Anything 8 and above, that is good. Anything like 7 and 5, that is like it's bad, but it's not that bad. But anything above below that, it's like really bad. And so, and then one of the things that you have to know, like acrocyanosis, where that is like the bluish of the hand, like the hand have a bluish color and the foot have a bluish color. That is normal for babies. So with the Apgar score, I'm going to show you right here.
The bluish, the discoloration, that can also be a test question because sometimes when the mother sees that, they're very worried. So you have to reassure the mom that it's normal. So you can just look out for that. So that would be a test question also. And even if you're still in school and stuff. Continue, Kim.
Okay, so with the Apgar score, I drew it right here. So you have, as I said, it score 1 minute of life, and at 5 minutes, 5 minutes, 5 minutes after birth. So you have it score respirate, so heart rate, respiration, muscle tone, reflexes, and skin color. So it's a zero. You give a zero, one, or a two. So what I do to remember the Apgar score, I just remember everything in the middle because it's a 3 column. So once you remember everything in the middle, if it's worse than that, it's a zero. If it's better than that, it's a two. So what I do is I just remember what's in the middle. So that's one. So anything below 100, you give them a one. If the restoration is slow and weak, they get a one. If the muscle tone is like limited reflexes, you give a one. If they are grimace to suction, or they don't really move, it's a one. They grimace a little bit, but they're not hyper extensive, and crying. You give them a one for that. And then if their skin color, which I talk about, which is the blue hand and feet, which is acrocyanosis, that is normal. You give them a one for that also. And the zero, if they have an absent heart rate or pulse, it's zero. If it's an absent respiration, it's a zero. If they are flaccid, you give them a zero for the muscle tone. Absent for reflex, a zero. And if they are pala or cyanotic, which is like blue, like white, like everything is blue or white, that means they're not getting enough oxygen. That is a zero also. So a perfect baby will actually have a heart rate above 100, and then their respiration will be vigorous. So their respiration will be anything from 30 to 60. That is normal respiration for infants. Their muscle tone will be good reflex and very active. Their reflexes, they would respond and they will cry, and active. They will have active movement, and then their skin will be normal skin color based on ethnicity. Okay.
All right, good job, Kim. So, we're still talking about newborn nursing care. All right. So, in maternity nursing, it's the nurse responsibility for the newborn after the baby is delivered. All right. If the baby going to be going to have any form of complication, the team would already know that the baby is going to born with some form of complication. All right, because they were monitoring the baby before. There are not going to be any surprise. I'm not put it this way: 95%. There's no surprise because they have been monitoring the baby, so they know when the baby born what to express.
Expect.
Foolishness. Anyway, expect. All right. So, say the NCLEX question give you something like the baby is going to be born and there is going to be complication and stuff. Normally, there's a team called NICU, the NICU team. After the baby is born, they would be the one to take care of the baby. The nurses in the NICU. All right. So in the maternity area, you have labor and delivery, maternity, and NICU. NICU is for critical newborns. Okay? So if the baby is going to born with complication, the NICU nurse will take over. So, you have to understand that when answering the NCLEX questions, because they'll ask you about the team. All right? All right. So, she went over the Apgar score with you. And then for the newborn nursing care also, there is an initial newborn screening that is taking place. That's where you look for abnormalities on the newborn. And if Kim, you want to go over some newborn abnormalities, you may.
No, I don't.
You don't. All right. Most of them they are in nursing school, so they are aware and stuff.
Maybe I could go over some.
All right.
Okay, so some abnormalities you can find with the newborn.
Because most of them already know.
Okay.
It's just a refresher course.
Okay, so you know about like the cleft lip and palate. So you guys make sure you know that we are the cleft.
Go ahead.
Where the cleft lip, you have to position the baby supine, and then with the palate, you put the baby prone, And when you're feeding the baby, you want to put the baby upright. And coarctation of the aorta. So you know that is a heart defect where the baby have they're getting perfusion everywhere above, like from their waist up is like perfused, so they'll have hypertension, bounding pulse, like everything will be okay. But when you check their blood pressure at their legs or their foot, they'll have weak pulse. They are going to be cyanotic down there where their legs is. So that's what that is.
Okay, try to remember the ABC when it comes to newborn nursing care and stimulation. So it's ABC and stimulation. You have to stimulate the baby. Also, and you have to keep the baby warm and dry.
Mm-hmm.
Then, so we go over Apgar Score, and we go over initial newborn screening. Then we'll talk about breastfeeding. Okay. So with breastfeeding, in the on the NCLEX, when they touch the breastfeeding, they'll also talk about formula. They don't normally give a lot of question on that, but if they talk about breastfeeding, they talk about the choice of feeding for the baby. Okay, the choice of feeding for the baby is breastfeeding. Reason for that, the breastfeeding, I'll give you two examples what it does and stuff. Breastfeeding helps with the baby. It helps them to it prevents infection. That's number one. It prevents infection. And breastfeeding also causes bonding with the mother and the baby. All right. There's many more. You can also, read up your notes and stuff. And then we have the normal newborn behavior. And so, like, the baby is born, and all the baby does is scream, 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 scream. Baby cries, yes, but the baby not supposed to be screaming continuously. So sometimes when the baby screams, and this can be test question also, the baby is cold. Most time when the baby screams, is the baby is cold. All right, and try to know the normal vital sign for newborn, because in pediatrics there are different types, different vital sign according to the ages. So for newborn, know the vital sign, the normal vital sign for the newborn and stuff. So I touch most of the stuff because I just touch some of the stuff that the NCLEX will go over.
Okay. Yes.
So if I can ask some questions if they want, some important things that they'll ask on the NCLEX and stuff. So let me see. I have something. Let me see if I read like a question or so from some past things that I have. If it will be helpful, let me know. All right, Kim.
Okay.
Because I'm not looking at your YouTube to see if what the comments are. All right.
No one's commenting. Everybody's just watching.
How many people watching?
7.
All right. I guess we're helping 7 people. All right. Say a 34-year-old woman. All right. She's 28 weeks gestation, and she's on bed rest. Okay.
Mm-hmm.
She's on bed rest due to consistent elevated blood pressure.
Oh,
All right. So
34.
the way
Okay, start over. I'm writing it.
all right. So the way we tell them how to answer the questions, we're gonna give them an example with this one. All right. Because the NCLEX is not trying to trick anybody, and most times the answer is actually in the question. All right. So, if the mother is 34-year-old, right?
34 weeks.
No, it's all right. Forget about the age. She's 28 weeks gestation. All
Yeah.
right.
Mm-hmm.
With consistent elevated blood pressure.
Mm-hmm.
So she's 28 weeks gestation.
Yeah.
And she's on bed rest due to consistent elevated blood pressure. All right. All right. So she called. Say she's home on bed rest and she's 28 weeks and she normally has elevated blood pressure. All right.
Okay.
Phrase it different, but it means the same. So while she's home and she's going through all of that, she calls her doctor. All right.
Mm-hmm.
And she's complaining that she's having a heartburn. So
Okay.
I'll repeat the question. So she's 28 weeks and she's home on bed rest and she has elevated blood pressure. And
Yeah.
she's having heartburn. So she called the doctor, tell the doctor that she has heartburn. She's feeling heartburn. All right? All right. Say you are the nurse and you pick up that phone. All right?
Mm-hmm.
So you got the message. So the patient call you and the patient said, oh, I'm 28 weeks gestation and the doctor stated that I should be on bed rest. All right?
Mm-hmm.
My diagnosis is blood pressure. I have one of my diagnoses is blood pressure and it's normally elevated, so it's consistently elevated.
Mm-hmm.
All right? But now I'm having heartburn. All right? So what you think the nurse should tell her? Because the nurse is going to answer that question for her. All right? So I'm going to give you four answers, and you guys choose which one.
Guys, are you guys listening? So you guys make sure you pick the answer. Put the answer in the chat.
All right. So let me go over the questions again. So she is 28 weeks gestation. You did write it, Kim?
Yeah. 28 weeks.
All right. All right, she is on bed rest with an elevated blood pressure. So the reason for her to be on bed rest is because she has 28 elevated blood pressure, right? And she's 28 week gestation. Now she's home. She's having terrible heartburn. All right, so she called the doctor. What should I do? She wants to know, I'm having heartburn. What should I do? I'm 28 weeks gestation, and one of my diagnoses is elevated blood pressure. All right, so as the nurse, what should you do? Should you tell her to lie on her left side for 30 minutes? Take antacid? No. Take antacid as soon as possible. As you finish talking to me, take antacid. All right? And or take your blood pressure and call back with the result, or talk to your healthcare provider, or talk to the doctor when you come in on your next appointment about your heartburn. What do you think, as a nurse, should you tell that patient? If you do it with the elimination that I show you, RC, you will get that right. Remember the elimination. Read the question once. then look for the stem in the question. All right? Or look for the problem. And then tell the nurse, they want the nurse to tell them what to do. Tell the patient what to do. Lie on your left side for 30 minutes. Take antacid. Take your blood pressure at the and call back and report the result. Or on your next appointment, report it to the doctor.
So what's the answer, guys? Daniel said lay on left side.
All right, I'll wait until, I'm not going to tell Daniel if she right or wrong yet, but I'll wait for 2 more answers.
I need to plug in this computer. I'll be back.
Well, I guess nobody gonna answer. Well, Daniel, let me see if it's Daniel. I can look. Daniel Allen. Thanks for trying, Daniel. You said left side. All right. The left side is incorrect. All right. So remember now. So we're gonna take 2 answers out that cannot be the. Sorry. We're gonna take 2 out that cannot be the answer. We're gonna take 2 wrong answers out. All right. Remember now, this is happening to first of all, the nurse cannot tell a patient to take a medication that wasn't prescribed to her. So take an antacid. That's incorrect. So that's 1 answer out. All right? Because I said to tell the patient to take an antacid. So that's out. All right. So the other one that cannot be the answer is to tell the patient to tell her doctor on her next appointment. That's delaying the patient concern. All right. And then let me see if somebody. So I take out 2 wrong answers. Let me see if anybody can choose. I guess
Yeah, you have
okay,
lay
so
them on the left side. Lay on left side. Lovely said take blood pressure. Joe said left side.
All right. So it was 2 answers there, the left side and the blood pressure. Remember, the patient was home due to consistent elevated blood pressure. All right. He's complaining of heartburn. So first you have to rule out when doing the NCLEX question or questions at school. Sometimes you'll see on the test 2 answers that can be the answers. All right, and sometimes you answer one of the answer and they said, oh, we are looking for the best answer. All right, so just critical thinking. they give two ailments inside there. They give elevated blood pressure and they give heartburn. Which one of these you think is more important? That will cause more liability? The heartburn or the elevated blood pressure? All right, so the answer is the elevated blood pressure. You have to take the blood pressure first because she has a history of the blood pressure. All right, and then if the elevated blood, because remember it's the nurse who answered the phone, not the doctor.
Yeah.
So the nurse can say give antacid. All right. So that's the reason why I took that out. But if the patient take the blood pressure, they want to know, because she's 28 weeks gestation. They want to know if it's too high or not. All right. So let me see. I'm not sure if I'm explaining it exactly lovely. That's the reason, because of preeclampsia. Yeah, and that preeclampsia, it's very important in maternity. All right, it's normally a problem and stuff. So most of your questions in maternity is going to base off elevated blood pressure, preeclampsia, eclampsia, and hemorrhage, and the medications. Hopefully I was helpful.
Was that helpful, guys? I think it was.
All right. So maybe I can give one or two more. I think everybody should get this question right. Everybody should get this one right. All right. So I'm going to give you something on the newborn or the fetus. All right.
Mommy, they asking what medication? What medication?
For what? No, there was a medication in the question, antacid. That's what I was saying. We cannot give it because we're not doctors. We have to get prescription. We all know that. So that couldn't be the answer. You can't tell a patient, go take medication, go take antacid because you have a heartburn. So that should be a wrong answer right there. So remember to take two. Don't even worry about the right answer. First, you take the two wrong answer out. Read again. And look in there, the stem. And then you answer the question. You're gonna, if you come between two answers, look for the one that will cause more damage to the patient. And choose that one. Like you'd answer ABC. You just choose airway. Because if the airway is stopped, the patient gonna die. So it's something similar to that, how you answer the question. You choose the worst one. What will cause more damage? That's why when you're taking the test at school, they say the best answers. We are looking for the best answer. Even if both of them can be the same question answer, they are looking for the best answer. Sometimes you get it wrong. All right. So the other one, I'll talk about like fetal circulation then. This y'all should know. So I'll say, like, say, Kim, you gonna write it or not?
No, hold on. Give me a second.
Because I can repeat it more than once, so they'll know. So with fetal circulation occurs, right, through the umbilical cord. We all know that. From the fetus to the placenta. So I repeat that. So fetal circulation occurs through the umbilical cord from the fetus to the placenta. All right? So, if fetal circulation occurs through the umbilical cord, from the fetus to the placenta, that normally occurs through veins and arteries. So, how many arteries and how many veins does a fetus have? So, do you want me to repeat?
Yeah, you can repeat it. But I think they didn't answer yet. But how many arteries and how many veins does the baby have? Just remember, Ava.
Somebody's asking, Joe, if you want to read what Joe was asking a question, Kim.
I answered.
Joe, oh, you answered? Okay. So, nobody answering? All right. So I'm just asking the question. As we know, fetal circulation occurs through the umbilical cord. Okay? From the fetus. So from the fetus to the placenta, it attached by umbilical cord. And those umbilical cord is vein and arteries. So I'm asking how many vein and how many arteries does the fetus has? Anybody answer? Do you want me to say?
Yeah, you can say it.
I guess. All right. So the fetus has two umbilical arteries and one umbilical vein. So there's two artery and two veins.
One vein.
All right. Sorry, one vein. My mistake. Two umbilical arteries and one umbilical vein. So the fetal circulation involves two arteries, one vein. All right. So everybody agreed on that? We have to agree.
Yes.
All right. So remember that. That's very important to know. That's also a test question. All right.
Mm-hmm.
So I'll give another example. All right. So in the NCLEX, they give you a lot of select all that applies. Some people will get more select all that applies than what they'll get with ABC answers. I mean, to choose one answers. All right. So
that's what happened to me.
I'm gonna give you a select all that applies. All right. I think I can find a question. So with select all that apply. I think I'll read this one. It says and I'll read it more than once. It said a woman in her first trimester of pregnancy arrived at the emergency department. All right. So the female, she's in her first trimester and she came to the emergency department. Okay. The patient is complaining of vaginal spotting and cramping. All right, so she's in her first trimester, and she came to the emergency room. And when you ask her what's the reason for being here, she said she is having vaginal spotting and cramping. All right, so they took her in the room to examine her. After the examination, she is diagnosed with incomplete miscarriage. All right. So let me say that again. All right. I'm gonna try to break it down. So she's in her first trimester of pregnancy. All right. She's having complications, so she went to the emergency room. All right. She reported that she's having vaginal spotting and cramping. After the doctor examined her, he diagnosed her with incomplete miscarriage. All right. So I want to know which symptoms is consistent with incomplete miscarriage. So let me see. Tell me if you guys want me to read it over again. Do you understand the what I just said? I guess I see some yes, Kim. You get it?
Yeah, I understand. Yeah, I think they
All right.
understand.
All right. So I'm gonna give you the select all that apply. No. So let me repeat. So she's first trimester. She's home. She's having complications, so she went into the doctor, which is the emergency room. When they asked her what's the reason for being here, she said she's having vaginal spotting and cramping. After the doctor examined her, the doctor diagnosed her with incomplete miscarriage. All right. So what's symptoms normally you see with incomplete miscarriage? All right. So you it's a select all that apply. So I'm going to give you 4 answers, and you choose which one, choose from that. So it's select all that apply. So it's uterine cramping, and we're looking at incomplete miscarriage. What are the symptoms? All right. So uterine cramping, that's 1. Mild to severe lower back pain, that's 2. Brown or bright red bleeding, that's 3. She's also having clots or tissue passed from her vagina, that's 4. And number 5, incomplete fetal height. Okay, so incomplete fetal height. So A, uterine cramping. B, mild to severe lower back pain. C, brown or bright red bleeding. D, clots or tissue pass from the vagina. E, increased fundal height. And we are looking at incomplete miscarriage. Okay? So you can just give me like A, B, C, D, E, or C, D, whatever, for the answer. So I'll wait. So it's select all that apply. Chris, Dupreen, it's select all that apply. So I'm looking for more than 1 answers. Kay said she didn't understand the question.
I didn't understand what she was saying.
Who said that, Kay?
No, I said I didn't understand what she was saying.
What
Because
I
Kay
was saying?
said 24 hours after birth. 24 hours at birth.
Who, me?
Kay. So I told her I
Oh.
didn't understand what she was saying.
Okay, all right. So meanwhile, some people answering the question. It's select all that apply.
So Daniel answered. He said 1, 3, and 4.
All right. So he said 1, 3, and 4?
Yeah, and then Christelle said 1, 3, and 4.
All right. So I'm going to give them, it's only 4 answers there. One is not correct. So it's four correct answer, 1 incorrect. And we're looking for incomplete miscarriage. If you think about it, normally when a person having miscarriage, what normally occurs? It's incomplete miscarriage.
So can you read over the answer choices?
Okay, so with incomplete miscarriage, right? Cramping, uterine cramping, mild to severe lower back pain, bright or red bleeding, clots or tissue pass from the vagina, increase fundal height. So there's one wrong answer there. Everything else is correct.
The one that's incorrect is the fundal height because it would be decreased, right?
Are you answer? Are you answer or?
Oh, I'm sorry.
Okay, that was for something else. Sorry. Okay. All right. So I'll let you know the correct answer. So.
And then maybe explain it because they didn't get it.
As I told, who have 3 answers there? It's 4 answers, correct answer, and 1 incorrect.
Lovely said 1, 2, 4, and 5 is the correct answer.
All right, lovely. All right, so 1 is uterine cramping. All right, so I'll take the wrong answer out, guys. And think about it. Incomplete miscarriage, right? The increased fundal height is incorrect. Because it's incomplete miscarriage. I mean, there's nothing, it's not growing or anything like that. All right. With miscarriage, normally there's bleeding. All right, and the bleeding should be bright red. Can be that bright red or dark or brown, but not supposed to be very dark brown. All right, and you have lower back pain, and you pass small amount of clots or tissue. So the answer is A, B, C, and D, or 1, 2, 3, and 4. So the answer is uterine cramping. So
Daniel got it right.
Daniel,
and Lovely got it right too.
Right. So any form of miscarriage. So they put the incomplete that they maybe it's kind of like throw you off. So any form of miscarriage, the patient is going to have pain. All right. So cramping, lower back pain, bleeding, and normally when they bleed, they have small amount of tissue passed from the vagina and stuff. So 1, 2, 3, and 4, or if you write A, B, C, and D. All right. So they want Okay, so one more question. I'll give them another question for magnesium sulfate. All right. So as we said, magnesium sulfate, and try to know that, try to remember that. That's very, very important and stuff. Normally given due to high blood pressure or preeclampsia. All right. So I'm asking, what is the antidote for magnesium sulfate toxicity?
What is the
All right. Antidote for magnesium toxicity. Did you not answer, Kim? You can answer last.
Okay.
All right, and stuff. If they want, I can give them. I'll give them like 2 minutes to answer. If you can't spell it properly, just write a few words, and I'll know what you're talking about. So for magnesium sulfate, what's the toxicity?
What is the antidote?
Antidote, sorry, what's the antidote for magnesium? Oh, okay, so Dupreme, I'm asking, normally magnesium sulfate is given, all right? For and it's normally given like 32 weeks pregnant for preeclampsia. So I'm asking, what's antidote for magnesium toxicity?
Okay, that's correct. They get it.
All right. They got it?
Yeah.
Okay, so good job. Good job. All right.
Okay, I have a question. What's the antidote for benzodiazepine? Nobody knows? What's the antidote for benzodiazepine? I guess nobody knows.
All right, type in the answer.
Flumazenil. So that's the answer, flumazenil.
Okay, somebody get it?
No, they didn't get it. They say
they didn't get it?
Well, their spelling is off, but yeah, it's flumazenil.
Yeah. All right. So I think I covered a lot, right?
Yeah. I knew that that's what you was trying to say because the ending was the same.
Mm-hmm.
Yeah.
Okay, one more thing before I go. Maybe I can touch with them because they normally ask this with the fundal height.
Yeah.
Of the uterus after delivery. Mm-hmm. So after delivery, the fundal height starts to shrink. Okay? And I guess you all covered maternity already, so you can visualize the abdomen. All right? So normally the fundus, it's in postpartum patient, after birth, the fundal height starts to shrink, and we have to remember each day it shrink by 1 centimeter. All right, just something to throw out there for them to remember. So each day after the person gives birth, the fundal height goes down by 1 centimeter from the umbilicus cord. So you will check from the umbilicus cord. When the just give birth at 0, and then it goes down 1 centimeter each day. All right? So it starts shrinking. Was I of help to you all? Okay.
Okay.
So did I hold on, Kim? So all right, yeah. So that's it right there, as Kim said. And so at delivery, you see, so each day it goes down by 1 centimeter. So you count 1 centimeter, 2 centimeter, 3 centimeter goes down and stuff. Yeah. And know your placenta previa also. They ask question on those.
Yeah. You remember the previa is painless and the abrupte is painful, bleeding, dark and painful.
All right, and yes, so the placenta previa, it's repeat what you said.
The previa is painless, and then the abruptio is painful.
Okay, right. So the placenta previa is, the opposite. So
Yes.
with the placenta previa, you're going to have bright red blood.
Mm-hmm.
With the previa, and the other one is opposite, dark. All right. So the placenta previa, it's painless. The other one is the rupture is painful
and dark.
All right, painful and dark. Previa, bright and painless. All right, and then the placenta previa, you'll also have abnormal fetal position and stuff. All right. With the abrupture, the abdomen is going to be rigid. Okay.
Yeah.
So I think I cover a lot with maternity. So
do you guys want to go over anything else in maternity or peds?
All right. So can the guest leave,
please? No, never.
Guys, hope I've been helpful to you all, and I wish you all the best. And I know you guys gonna pass your NCLEX. Don't worry about it. To be honest, it's actually easier than your schoolwork. I'll say that. If you continue studying and do whatever you're supposed to do and stuff, when you go to the NCLEX, just take your time and answer your question. Don't rush, because you get a lot of time to do it. All right? So not to worry. If you're still in school, the most important thing for you is try to pass your whatever they're giving you in school, so you can go ahead and take your NCLEX. And after the NCLEX, you have no worries. All right. So hope I was very helpful to you all, and good night.
They say thank you.
All right. And thank you also for being here. Oh, guys, I should have said this earlier. I didn't remember. I also have a YouTube channel. Sometimes I know you're in school, but Kim, is it possible for you to just put my little stuff up top?
Yeah, it's in the. It's right there. It's the pinned comment. So just look up top, and that's just click on that little thing, and it will bring you right to her YouTube channel, and then you can
Yeah,
just
that
subscribe.
right. That says please subscribe. It will be greatly appreciated. Please show support to my channel. My channel name is Utopian Family. All right. Thank you and have a good night. Bye bye.
Bye. Okay, guys. So I guess it's only us. So what do you guys want to go over? What else do you guys want to go over? I think my mom covered almost everything that you guys need to know in Pete and OB. So tell me what you guys want to cover, and I'm going to. I have all my notes right here, so we can do that. Cover every single thing what you guys want to do. I don't know what you guys want to cover, and then um, yeah, and give you guys maybe an hour, one more hour, and then I'll leave. So yeah, can do that. Just let me know in the comment section what you guys want to cover, and I'll do that. So I'll wait for you guys to say what you guys want. Lovely, say thank you. You guys don't know what you guys want to talk about. Oh, and you guys can also call in. Let me pin that number. So I will not cover pediatric. I just cover stuff that will cover. Oh, okay. Well, you kind of did cover that. I'm going to just let me see if I can pin it. Yeah. I'm going to pin this number, and you guys can call in, and we can talk about like whatever topics that you're struggling with, and maybe I can be of some assistance to you. How often will you do this live study? Are the English question hard? No, just know your content. So I just started yesterday, Christelle, yeah, I just started yesterday. I We did endocrine and we did PPE, and what's his name? I don't know if it's even a girl or a guy, but Eyes Wide Open. That person just did the NCLEX, and the same thing that we covered yesterday. The person said that it was on their NCLEX. They said that a lot of it was on the NCLEX, on their NCLEX. Prioritization, need help. Do you want to call in? The number is pinned at the top, so you can call. Let me see. Okay. Nobody want to call in? No? All right, let me go over the prioritization and delegation stuff. So, what I do when I'm doing prioritization and delegation, I look at the question, right? And who am I delegating to? Am I delegating to PCT or UAP, or am I delegating to uh, LPN. With LPN, they can do most like they can do most medication, like oral medication, but they cannot give blood products. They cannot give Rogam because that's a blood products, and they'll try to trick you with that. And also, but they can do like NG tube. They can do like assessment, but they cannot do the initial assessment. So they can do like if the nurse do the first assessment, they can go ahead and follow up with that, and then for the and then they can do like feeding tube, peg tube, stuff like that with stable patients. So you want to give them stable patient. With the PCT, they can only do like LBN, ADLs, which is assist daily living. Yeah, so they want to assist the patient with daily living. Can we please review GI and nutrition? Yes, we can do that too. Just give me a second. So with that, they can only do like bathing, like normal things that you know how people that are not certified or are not trained, like anyone can do. That's the only thing that they can do. They can only the only can like stable patient. That's it with those people. So if you get a question saying who so you have a patient that have a stroke, right? You have a patient that have a stroke and their meal tray came in. Who can the nurse delegate that task to? Who should the nurse delegate that task to? A patient that just had a stroke and they came in, just had a stroke, and their meal tray is here. Who can the nurse delegate the task to? So with that, they cannot delegate it to a LPN, and they cannot delegate it to a PCT because no, you cannot delegate that to a LPN because the patient had a stroke. So the patient eating would be an initial assessment, right? Because you have to, before the patients are eating, they have to do the gag reflex. They have to have back their gag reflex and see how the patient is um like doing with eating, if the patient is eating properly, or are they at risk for aspiration. And yes, so the nurse have to do the first feeding, and then after that, when the nurse see that the patient can eat, they yeah, so if the nurse see that the patient can eat, then she can delegate that task. And then when to feed the patient, it will more go to the UAP instead of the LPN. The LPN is more like giving like oral medication, and then doing NG tubes and like G tubes, stuff like that, colostomy. Yes, so that's what they do. So that's what they do. And then how to measure the nasogastric tube. So it's from the bridge of the nose to the earlobe right here, and then you put it down to the xiphoid process. So that is how you remember that. And if you can't remember that, just remember next without the T. So this is how you do. So nose, let me type it. So nose, ears, xiphoid process. So that's how you remember it. Thank you for the like. Thank you for the like. If you want, you guys can call in, as I said before. So let me go over GI and nutrition. Let me see. So let me talk about GERD. So GERD is GI. So with GERD, you know that the food is most of the time the patient is like eating too much. You're eating very fast, and then they're laying down, and the food just start coming up, like start coming back up. You'll see that with a lot of people that is overweight. So with GERD, you want to make sure when they eat, you want to have them sitting upright after they finish eating, and then you don't want them to be eating and drinking at the same time. Oh, sorry. You don't want them to be. I just shared the live on WhatsApp group on Facebook. Oh, thank you. You guys, make sure you subscribe to Utopian Family. Let me link that back. Do, 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 do. Yes. That was my mom. She was the one that was telling you guys about the pizza and OB. So yes, so that's what you do with GERD. After they finish eating, you want them to sit up, and you want them to stay up for at least like an hour or so after they finish eating. And then with that one, then with dumping syndrome, that one is when they are eating too much, or they are eating too much, but the food is it's like going too fast. Yeah, it's going too fast. So you want to when they finish eating, you want them to lay flat. So with dumping syndrome, it's a lay down. So just remember the D for dumping syndrome is down, and then with GERD, it's up. So that's how I remember it. So dumping, D down. Food is not being digested, they must lay down. Yes, dumping is down, and then with GERD, it's sitting up. Okay, back to do some nutrition. Let me see. I have some notes on nutrition. Hold on. Ooh, ooh, this is my fundamentals. No. Oh, oh yeah. Okay, so I can talk about cystic fibrosis. Let me talk about cystic fibrosis because that is also GI. So with cystic fibrosis, it's when it normally occur in children. It's when there is oversecretion. So they have a lot of mucus. It's very thick. They have decrease. It's like interfere with their fat soluble vitamins. So that is ADEK. So I remember ADIC. Let me put that right there. So you guys, so these are your fat soluble vitamins. This is also good for Europeans too. So yeah, so this oh, let me read from this thing, so you so I don't. So yeah. So with cystic fibrosis, it is autosomal recessive disorder, and then it's a buildup of excessive mucus. So it affects everywhere in the body. So it affects the GI system. It affects the skin. So you'll have like very sweaty skin, and then the skin will actually start tasting like salt water because of the chlorine. And then the male, because of the duct, the male patients or the males that are affected with that, they will become infertile with that. And then their stool will be large, bulky, frothy stools. It will have like a foul odor. And as I said before, they have fat soluble deficiency, which is ADEK, ADEK, vitamins. So you have to give them those vitamins. And then the first sign for cystic fibrosis is the meconium ileus. So the children, they're not going to produce the first stool with cystic fibrosis because everything is like like very sticky. Yeah, it's a very sticky. They can't like nothing is coming out and nothing is going in. So that's what that is. They also do like the chlorine sweat test, and you will see, as I said, it will be a very their skin will be very salty. You can actually like taste salt on their skin. And then you have the genetic test for that. And then the treatment for the cystic fibrosis, you want to do the chest physiotherapy, which is using your hand, and then you want to make it like a C, like this, like a cup, and then you want to just percuss on their chest or their abdomen or all over wherever you're trying to get rid of the excess of mucus. And then you want to give them pancreatic enzyme because of the deficiency in the fat soluble vitamins, which is AD, E, and K. And you want to give them a high protein diet with high calories because it's like they have so much mucus in their body. It's just everything is just sticky. And yeah, you just want to make sure that they have enough food. And if they have um the pancreatic enzyme, when you give them the pancreatic enzyme, you have to give them because they cannot oh yeah, they cannot or the pancreas, they you give them pancreatic enzyme because of the deficiency in the fat soluble vitamins. And then with that you give it 30 minutes before eating, or you give it with the meal. So you give it 30 minutes of 30 minutes before eating every single meal. So if they're going to eat a hot dog, you give them it. If they're going to eat some candy, you give them it because the food is not going to be digested with that. Thank you to the one person that subscribed to my family channel, YouTube and family. We did not, please give support to the family channel. Thanks to those who subscribed yesterday. Yes, guys, please go ahead and subscribe to Utopian Family. She just spent 2 hours with you guys going over material. So that's the least you can do. Um, is there any other nutrition questions, like any other nutrition topic that you want me to go over? What other nutrition topics do you want me to go over? All right, guys. I guess you guys are tired like myself. So if you guys don't want to talk about anything else, I'm going to leave. Okay. So just tell me in the comments what other topics you want to talk about, and I'll talk about them. And you can always like rewatch this video And I also did a video yesterday, and that was talking about the PPE. That was really good. As I wide open said before, that it was really good. Some common drug classes that's on the NCLEX. I don't know. Everyone exam is different. Just remember the major drugs. And I did go over drugs yesterday on this channel. I did if you watched the video yesterday, the live yesterday, you will see I went over endocrine, I went over psych, and I did medications. So you can go ahead and watch that video. Yeah. Are there any more topics that you guys want to go over? Okay, I'm gonna ask you. I'll watch it. Okay, I'm gonna ask you different stools, and you tell me what disease it's from. So, if the patient comes in with bright red blood, thank you. You're welcome. If the patient comes in with bright red stools, what GI bleed is it? So bright red stool, what GI bleed is it? Is it a upper or a down? Is it upper or lower GI bleed? So this is bright red stool. Is it upper or down or lower GI? Okay, bright red. Mm-mm. Bright red, no. You gotta think. Remember, if it's bright red, it's gotta be closer to the exit. So if it's upper, yes, it's lower. If it's upper, it's going to be very dark. Because remember, it have to come down and go through um the bile, and then the bile is going to turn it a different color, so it's going to be dark for upper, and then for lower it's going to be red, very bright red for lower. So red currant jelly stool, what stool is that? Like, that is a hallmark sign for what? So that is red currant jelly. So that's what I'm gonna do for the next couple hours. Just gonna ask question and you guys answer it. So the red currant jelly, no one knows. Okay. Indecision. I have that. Okay. You guys didn't know that. So it is that. All right. The frothy, foul smelling stool. Can we review, please? Fundamental, advanced directive, and medical emergency. Who cannot give consent? All right. Okay, we can do that. We can do that. Fundamentals. There's so much thing in fundamentals, so we can do that for a little bit. So I have my little cards right here for all my fundamentals, and then I have my book. Let me see. Hold on. Oh, pharmacology. Hold on. I'm trying to look for the fundamentals thing. Okay. So with fundamentals, let me see the torts. So what you have to like negligence, malpractice, battery, and assault. So basically, battery is when you put your hand on someone. So the way how I remember it, the difference between battery and assault is battery. You take the bat and you hit them with it. So I hit you with the bat. So that's what I think. Battery, I hit you with the bat. Battery, I hit you with the bat. So that is actually putting your hands on someone. Assault is just just cursing, just talking, just verbally, nothing physical. So that is the difference between those two. Um, then we have like um, fidelity, which is keeping your promise. Then we have um, magnificent, which is doing no harm. So when you think of non-magnificent, just think of Magnificent, that cartoon where she is very evil. So you have the before it. So think of doing no harm. Yes, assault is threat. On the next schedule live study, please do med search and farm. I did farm yesterday, but I could do med search tomorrow. Okay. So I'm gonna go over the different cultures. So I'm gonna go over the different cultures with you guys. Um, so fundamentals, the different cultures. So in African Americans, so Ed bobbing, it does not always mean that they agree with you. Pharmacology, please. So at Bobbin, it doesn't necessarily mean that they agree with you. And then Prolan, I can't speak for nothing. Yeah, like eye contact, they may interpret it as being very rude, and they don't really like that. That is the opposite with Caucasian. Caucasian, you have to look them in the eye, but with African American, you do not want to do that too much. With Caucasian, you have to do that because if you don't, they'll think that you're not trustworthy. And then um, with African American, so personal question asked on initial contact with the person may seem intuitive. So they don't like you to be asking too much personal question to them on the initial interaction with them. And then some foods that are seen in African Americans, or the major food in African Americans, are fried food, the chicken, pork, rice, and then pregnant women for African Americans, they normally have pica, which is like eating non-food substances, so eating like chalk, scraping the wall, eating the paint, just eating non-food substances. That's what that is. Yes, and then some health risks with those people. The African Americans are sickle cell anemia. They have hypertension. They're more prone to hypertension. They're more prone to cancer, lactose intolerance, and also diabetes. So Amnish, so those people, they are known for simple living, and then they dress like in plain dress, and they try to stay away from technology or modern living. So those people, they are they they don't use technology at all. And then when, like, if they're dead, they use a plain casket, and they normally bury in the house. And then man, they are the main, like, the ruler of the house. So they have like the main saying in that group, the Mormons, the Amish, I should say. And then for their language, they speak German, so that is Pennsylvania Dutch. They speak Pennsylvania Dutch in worshiping, and then in school they use English. And then for their work, they're now like farmers, builders, and like just sewing and stuff like that. And then some risks, some health risks for those people. Amish, they normally have like inbreeding, because they don't go out and like expose themselves to other people. They just stay in one group and stuff. So you'll see like the mother have a child, and then the child have a brother, and then the brother and the sister get married, and then they have kids and stuff. So that's what I'm talking about when I say inbreeding. And then they are not immune. Yeah, they are they don't they don't get immunization. Yes. So that's, and then the women are often sexually abused with those. um so let me go over Asian Americans right now. So with Asian American, silence are valued, and then they try not to do eye contact. They think that if you stare them in the eyes, they consider to be very disrespectful, very rude, and they do not like that, none at all. So Asians do not like eye contact. Black Americans do not like eye contact. The only culture that like eye contact is Caucasians. So those are the only people that really like eye contact, and then say no is they consider to be disrespectful. So Asian, they were grown up to say yes to everything, even when they didn't really want to. So yes, saying no is considered to be disrespectful. Touching is unacceptable for opposite sex. So if you are the nurse and you have a patient that is um Asian, you want them to have a same sex healthcare provider. So if you have the nurse, which sometimes you have a male nurse and you have a female Asian, you do not want the male nurse to go in there and take care of her. You want to assign that patient you want to assign that patient to a female nurse. So you want to have same sex same sex person looking after those people. And then education is viewed as important for for Asian Americans. And then they not for food, they normally have raw fish, vegetables, and rice. The risk factors for Asian Americans are thalassemia. And then they believe in yin and yang. So yin is for cold food and yang is for hot food. So if they have a hot disease, they eat cold food. If they have a cold disease, they eat if they have a cold disease, they eat hot food. So if they have a fever, they'll eat something cold because fever is considered a hot disease. Okay, so now let's go over Buddhism. So they avoid alcohol. So alcohol is prohibited for them, and they are lacto vegans, vegetarians, and then they avoid beef because you know that Buddhism, that's in that religion, they worship the cows. Yes, they worship the cows. And then now we're gonna go over Mormon. So Mormon, they avoid alcohol, coffee, and tea. So they do not drink anything with caffeine. So anything with caffeine is not good for Mormon. I'm studying for the NCLEX. What study? What's the study guide? Hmm. I'm going to do a video. I'm going to do like a 10 minutes video and then show you guys exactly how I created it. And then maybe I'm going to in that video I'm going to have maybe a Google Drive where you can just download the study guide for yourself. I'm going to try to do that maybe like tomorrow or so. Yeah. So with that, Mormon and the next thing, as I said, they avoid everything in caffeine. And then the first Sunday of the month is optional for fasting for them. Hinduism. So Hinduism, they avoid pork and beef, and then many of them are vegans. So with Islam, so pork, birds of prey, alcohol, or any meat that is not religiously slaughtered are prohibited. So they're very strict. And then fasting occurs during the daytime. So now let's do Jews. So with Jews, they do like a kosher diet or kosher law. So meats are not allowed. Like meats cannot be mixed with dairy products. So you cannot have like chicken and then you have milk. You cannot do that. They do not want meat and dairy to be mixed together. These are for Jews. So meat allowed, including animals that are vegetarian eaters. So like deer, cattle, goat, and sheep. And then fish that have scales are also allowed, but they cannot have they cannot have a shellfish. So like lobster and shrimp, they cannot have those. Those are prohibited. And then they can have meat and milk, as I said before. And then during Passover, only Lent. Okay, yeah. Okay. So now, Saturday Adventist. Excuse me. If I'm boring you guys to death, let me know. So Saturday Adventist. So this one, alcohol and caffeine beverages, they are prohibited. No pork, so they can't eat pork. Overeating is also prohibited. And then 5 to 6 hours meal between snacking. So that's what they practice. Oh, and I hold on, I don't see Muslims. I don't have Muslims are here. Okay, I don't have Muslims. So let me just tell you about Muslims. So Muslims, they want the same sex to to take care of them. And then if there is no Muslim, if they're when they like expire, when they're dead, they want their wife to take care of them. They don't want a next. If you are if it's a Muslim lady, she don't want a male nurse or a male doctor to take care of her. Or if it's a Muslim man, he doesn't want a female nurse or female doctor to take care of him. So they do same sex, and then when they're dead, they want you to they face the Mecca, so that is um the east. So they face the Mecca when they're dead. Um, okay, so I don't know. I just have this heart failure. What is the best indicator to monitor for heart failure? And then I have weight. Living will, advance directive. Who can give consent in case of medical emergency? Okay, so um, with living will, so basically it's the patient just writing exactly what they want to happen to them when they are in camp, when they can't do when they can't do anything for themselves, or they become incompetent. So that's what that is, the living will. And the patient, it can they can change it however how many times they want. And they it can be either written or oral. So yes, it can be either written or oral. And then with the income with the in informed consent, with informed consent in emergency situations. You don't need informed consent in emergency situation. So if you have a patient that comes in, and the patient have a chest wound, that the patient is you're waiting for the informed consent, or carry the patient to surgery. You're going to carry the patient to surgery, because if you wait for the informed consent, the patient can die. So you can do that, just go to surgery. Or if that or if you have time, or so two doctors can give informed consent if the patient is out of it, you know. Oh, you're welcome. You're welcome. Please post this. I am so late, but I appreciate you so much. Oh, yeah, I will. It will be up. I won't delete it. I won't delete it. So yes, so that is informed consent. Like if the patient is you just come in with gunshot wounds, or you just get stabbed or something like that, something emergency, you don't need informed consent from the patient. So they can just rush them right to surgery and stuff. Yeah. But if you do have like a question with that, you can pick that. Or if that's not there, the next best option is getting two doctors to sign the informed consent. Okay. Okay, so who can tell me the stage of grief? Who can tell me the stage of grief? The stages of grief. Okay. So the stages of grief are DABDA. So denial, anger, bargaining, depression, and acceptance. So that's what that is. DABDA. Let me see what else. Oh, and then with the PCA pump, you're supposed to teach the patient or family member only the patient can push the PCA pump. The family members are not supposed to take it, like push it. All right. Overdose for heparin, it's prosamine sulfate. So heparin. Oh, so that's what that is. And then I told you guys about this already, the amylase, where you give them 30 minutes before they start eating, because that's what's gonna digest the food. Yeah. And you do not want to crush that medication. It's an extense relief medication. Um, So with Hinduism, illness is the result of past and current life action. The right hand is seen as holy, and eating and intervention needs to be done with the right hand to promote clean healing. So with Hinduism, they use the right hand. So they believe that the right hand is the good hand and the right hand is the best for everything. Okay, so now we're going back to cultures. So now this is Hispanic. So you want to ask permission before touching a child. Some believe that touching the child is important when speak. What? Some believe that touching the child is important when speaking to the child to prevent evil eye. So that's what they believe in. Like if there is a Spanish person and stuff, and you're looking too much at the child, they believe that you're going to curse the child. So yeah, so they believe in evil eye. And then with that, they're more like their religion is like Catholic. I keep So their religion most of the time is Catholic, and then they normally have like health risks, parasites, and lactose intolerance. Okay. Do you guys want to go over anything else? Because I think that's it. Oh, let me show you guys the triage. Oh, these are the different types of seizure. So I can just go over this with you guys. The absent seizure. So the absent seizure is basically the child have the seizure, but the hallmark sign for that is staring out of space. So you'll just see them looking like, and that's the absent seizure. So they'll just stare out of space. And then with the simple partial seizure or the Jackson seizure, the patient will be in an awake state but will exhibit abnormal motor and autonomic behavior that can affect any part of the body. And then a grand mal or tonic clonic seizure. That is this type of seizure is which there is rapid extension of the arm and legs with sudden jerking and loss of consciousness. So jerking is like the hallmark sign for that one. And I already go over these. Okay. I think you guys are good to go. You guys want me to come back tomorrow? Because I think you guys are tired of me. Tell me if you want me to come back tomorrow. 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 Boo, boo, boo. Get some more. Yes, please. Okay. Yeah. Yeah, I think I'm going to leave now. Um, what about eyes? Oh Lord, you're trying to kill me. You see how long I've been on this thing? I've been on this thing 2 hours and 51 minutes. I'm super tired. I need to go to bed. Do you have any? It is okay tomorrow. Yeah, tomorrow I'll do that. Tomorrow I'll cover it. But yeah, I hope I was of some help to you guys. And I hope you guys enjoy it. I think maybe I'll do this until the end of November, and then I'll stop and go back to my regular schedule. But yeah, or maybe I'll do like some short videos, like some 10 minutes video, and then it will be of more help instead of doing long lives, because this live is like 3 hours, almost 3 hours. Yeah. Is there NCLEX coming up soon? Yeah. Okay. Okay. You should be good. Next month. Okay. Yeah, that's my birthday. Next month's my birthday too. Mm. So you'll pass. You'll do good. When you pass, just come back and let me know. And I'm gonna be cheering for you and praying. Okay? But yeah, you'll pass. Hey. Make sure you like this video and go over to Utopian Family. I think I pin it in the comment so you guys can just go over there and just subscribe to her. Please. 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 You can call in because I'm here bored doing nothing. Doing nothing. Nothing yet. Finish with my studies. Just waiting. Yes, hopefully, thank you. Yeah, you'll pass. No doubt. You will. Just don't be nervous. Like I can't tell you not to be nervous, but just try to control your anxiety. All right, guys, I'm gonna leave. So I'll see you tomorrow. I is Do you guys want to come on at 6 o'clock, or you want to come on earlier? What time is best for you guys? Let me know. Yeah, please come back tomorrow. Okay. Yeah. Do you want me to come on earlier, or 6 o'clock is okay for you? Whatever is good for you. Listen, I'm just here doing nothing all day. So you tell me the time that's good for you and I'll be here. Okay? Just let me know what time is good for you and I'll be here. We're just wrapping up. I'm going to leave. I just want to know what time is it best to come on tomorrow. If I should come on at 6 o'clock, or I should come on a little bit earlier. I don't know. What else? What other question you guys have? Maybe I could answer them. Cause okay, I think I'm gonna just leave. So I'll see you guys tomorrow at 6 o'clock. Make sure you guys are not late. So I'm keeping you guys accountable. Okay. Okay. All right. Make sure you guys are not late. So I'll see you guys tomorrow. Bye. And you guys can go watch my video if you have time that I posted today. How do you end this? I'm trying to end this live and it's not letting me. Let me see. Oh, right here. Okay, guys. Oh, somebody just commented. I think. Okay. All right, then. I'll see you guys tomorrow. Bye. 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 Bye.